So, really quick ramble because I have a minute and I'm just trying to burn some time. And I came across a comment from the loner a couple months ago because somebody else commented on the same video today. But his comment said that he celebrates every one of my rambles, says they're the best of my videos. So, uh, it's like, what can I ramble about right now? Just burn this 30 minutes up before my next little appointment. So, I think today I'm going to talk about what the worst drug is. Right? Now, mind you, I am an addiction counselor, but I have not done even half of the substances that my clients have told me they have done. Not even 10% of what they've told me they've done, to be honest. And so my experience with what the worst drug is not from the point of view of somebody who has done them. It's just, I have the point of view of somebody who helps people rebuild their lives after the worst has happened to them. So, that's my point of view. It is a bias. It's huge because I can't tell you about the benefits of these drugs personally, directly, or even the downside, really, personally. It's mostly secondhand knowledge that I've picked up over the last few years of counseling people. So, the worst drug. You have to break it up into categories, right? Because what does worst mean? So, when I ask other people what the worst drug is, usually they say either heroin or meth. That's when people respond to me with that question asked to them, they will say heroin or meth. And those two have, a pretty good reputation for the ability to destroy people's lives. But if you were to ask me, what drug do most of my clients end up coming to me for help with, that's alcohol. 95% of my clientele, either in my current practice or in my previous jobs in residential therapy or in the detox, 95% easily is alcohol. Very often there are other substances involved with it. Sometimes you get what we call the pair with a spare, where people will do alcohol, tobacco, and cannabis because those are the ones that are legal to a degree in my state. But usually the big issue is alcohol. I would say the worst one for being socially acceptable and therefore just widespread and prevalent without anyone realizing what the problem is that it's causing would actually be either caffeine or tobacco. As far as it's available everywhere and it's doing damage to people that they're just not realizing in the moment. And of course, alcohol is socially acceptable and has a lot of advertising, but people realize what it's doing to them. Other drugs, not so much. So there, as far as the worst of being able to sneak up on you and then cause problems later on down the road, either tobacco or caffeine. The worst in terms of the most conspiracy theories and anti-science rhetoric would have to be cannabis. Hands down, when I run into people who think that cannabis cures cancer, or cannabis. It does nothing but good for them. No one's ever died from cannabis. Nobody's ever had adverse effects from cannabis. It's all in their head. All of these things that I've heard people say. I'd say that cannabis is the worst for having this this fan base that just does not believe that it can do anything bad in anyone's life. The most dangerous drug that people abuse that can kill you within like one use, you might have a chance of overdosing, would probably be carfentanil, and then fentanyl behind that, and then heroin. And that's one of the reasons why heroin has such a reputation. The most dangerous, the other way around, from withdrawal rather than from using it, would be benzos, but really benzos mixed with alcohol. When somebody's drinking and doing Xanax at the same time and abusing both, to a great degree, that is the combination that I would look for as far as killing someone when they stop using rather than when they're using. So in that sense, it's the worst one in terms of dangerousness when you're quitting. The most painful withdrawals, the worst in terms of painful withdrawals, would be from opiates. Your heroin, your fentanyl, Oxycontin, that kind of thing. The worst looking. I would say it's meth, because I can see meth in some people. I'm like, that guy, nothing does that besides meth. But meth mouth, I've seen a lot of. I've seen abscesses on people with meth use, but also heroin use. But crocodile does a lot in other countries that it isn't doing in mine. But I've seen, videos and documentaries and if it weren't for, the lack of prevalence in America, I would say crocodile. But from what I see right now, it's meth. And also, meth is the worst for what I would call a burnout brain. Where it takes a lot longer for someone to get their personality and their full use of their brain back from meth than any other drug. It really, really is something to behold when you see that it takes about a year for every month of use, as far as somebody getting their mind back. And some people they've just used long enough so that by the end of their life, there is no chance for them to get their total personality back. It's just, a matter of how good can it get versus a total recovery. You're just looking towards, well, can we get mostly recovered? And then there's one thing that I have noticed, that the worst drug for causing strokes and narcolepsy and certain type of dementia is actually cocaine. If I ask a certain demographic of people what type of drug they used in their 20s and 30s and 40s, and then I compare that to who's having strokes and heart attacks and narcolepsy later in life. And that causes a certain type of care to be needed later in life, a certain type of rest home, for the kind of person who has, multiple strokes in a year. So, worst in terms of needing to have that kind of help later in life, I would give that to cocaine. So, what's the worst drug? I don't know. What's your worst nightmare? I'll tell you which one achieves that for you. But if if it's pain, then the withdrawal from opiates. If it's not wanting to have your mind slip away because of strokes later in life, then there's some other drug that might get you there to that nightmare scenario. If you're afraid that something's going to kill you right away, then again it would be up the opiate chain of drugs. Something that's going to be something that you can hide for a while and will still destroy your life and make your friends not want to be around you as much. I'd go with alcohol. It's it's really a subject where you have to get down to the brass tacks of what makes something the worst, if you're going to answer the question. Anyways, enough of a ramble. I burned up the time I need to burn up. Talk to you later.